planet. The way they arrange the planets. But the last one.
You're on Pluto? Or is it, which one is it?
Yeah,
Is that new one?
See Pluto, your planet is a star,
It's
something,
a what?
something. But Kwame, I'm right. I'm not on planet Earth with you guys. So. You see, Ukonya manager, curly hair, beard, curly hair. Then he says we should suffer. And suffer. Then we sack him.
Charlie.
But,
Man, you for cry.
but who has mentioned any team?
But you are talking about Man U. I know you are talking about this one.
The team of the moment. The team of the moment. That's this we won't play small teams. We don't like small teams. Bring us Real Madrid. We don't like small teams. We won't play. Small teams. Man City. Arsenal. Yes. Real Madrid, Barca. That's what we want to play. We don't. Good afternoon to all our listeners, and it's good to be here. Special good afternoon to all Man United fans.
Hey,
the Red Devils.
Wow.
Yeah, near too many Ubi Bobo, your friend Jesus. Then the Devils can bench Jesus. Look, you should have invited when Daniel Krati was here. We should have done the show together. Don't Arsenal have a player called Jesus? 56 minutes, they substituted him.
So even Jesus couldn't help them.
The Devils.
The Devils. The Devils defeated Jesus.
They say, why do you?
Please, doctor for sale. Doctor for sale. I'm tired of you. You and Danny. I'm tired of the two of you.
That
we are short-lived though. We are just a 9-day wonder. When your new coach next weekend, yeah.
We have something to discuss today.
Okay.
Very important.
Anyway, I'm happy you're here, Doc.
Yeah, good to be here.
But I need to emphasize though. But I need to say, I know our folks normally listen in. We have a lot of people also watching us on social media.
Oh, okay. Yeah.
I don't know whether they see what I see, but this year you are a happy man.
Oh,
and
yeah.
you glow anytime you come into the studio.
Part of the vibe is also you know.
I really, yeah. But I need to say because you know sometimes when you come in, I probably might not be feeling myself.
Yeah.
But you bring some excitement, you bring some glow.
Thank you.
You look so happy, and I'm happy.
Thank you.
I'm sure you've got your own issues, but you're hiding it pretty well.
Oh yeah.
Anyway, so let's get on to talk about anemia in pregnancy. The past couple of weeks we've been focusing on our women and conception and even couples. I think last week we talked about preconception care. Yeah, and anemia in pregnancy is a very, very delicate part of this whole process, isn't it?
Yeah, it is. And Kwame, we got someone sending me a message, regarding anemia in pregnancy, because they listened to the show. We talked about preconception care, and then also because I had one of my patients who is a sickle cell sufferer come in with intentions of wanting to have a child, all right, and her HB was low.
Okay,
and that was the subject of the conversation 2 weeks ago. She was like, "Doc, if I want to have a baby with this blood level, can I have a baby safely?"
Okay.
So today I want us to look at anemia in pregnancy, and we've got quite a bit to cover. So we'll zoom into it right away. So Kwame, what is anemia? Right, anemia is a condition in which the number of red blood cells, or what we call the hemoglobin, the HB, concentration within them is lower than normal. Right, so the hemoglobin or the HB is a pigment which is found inside red blood cells, all right, and it carries oxygen around your body. So when you lose your red blood cells, you don't have enough hemoglobin because the hemoglobin is found inside of the red cells. So anytime we mention anemia, then we're saying that either you don't have enough red blood cells, or the hemoglobin pigment, which is contained in the red blood cells, the concentration is low. Typically, you would go to the hospital, the doctor would examine, or look at your eyes, or look underneath your eyes, look at your palms, look at your fingernails, your nail bed, and then think that, you're pale. Why don't you get a blood test? Let me measure, quote, your blood level. That is how most people would understand it, your blood level. Anemia is not that when we prick you, will not get enough blood. No. It is about the content.
Okay.
All right? So you've got the cellular part of blood, the cells. And particularly, we are talking about the red cells. And the red cells contain a certain pigment that carries oxygen, which is called the hemoglobin, or HB. Most people would have had this test done at some point or the other. The optimal hemoglobin concentration varies, all right, by age, one's sex, smoking habits, and pregnancy status.
Smoking also affects that?
Yes.
Wow.
All right. So if you're a smoker, what is optimal is different from if you're a non-smoker. So that's one of the effects negative effects smoking has on individuals, because it will bind, some of the hemoglobin, make it unavailable. So your levels. So we don't have a standard. Somebody cannot just pop a question at me and say, okay, doc, what's the normal hemoglobin? Well, I need to know whether you are male or female, need to know your age, and then also need to know for women in the reproductive age group whether you are pregnant or not. Then the number or the level then differs. So anemia is any number that is below what is recommended for a person's age, a person's sex, a person's pregnancy status, and then also smoking habits. Right. So different numbers would come up, and I need people to understand why different numbers, come up. Globally, anemia remains a major public health concern, particularly among women of the reproductive age group. It affects about, globally, 30% of non-pregnant women and about 37% of pregnant women. That's some statistics coming from 2019.
Okay.
If we look at that same year in Ghana, then it was about 50.4% of pregnant women were diagnosed with anemia. So half of all women coming into the hospital for antenatal care who were pregnant had anemia. So it is very, very important that we talk about it today. Now, what happens during pregnancy with respect to the red cell concentration or the hemoglobin? All right. Kwame, usually during pregnancy, you'd see, and I'm sure you and I, we've seen our spouses go through pregnancy. They get some pedal edema, they get some facial puffiness. Even some of them have to take off their wedding rings because it fits too tightly now, or during the pregnancy period. That is accumulation of excess fluid or water. Party drink.
Yeah.
So it's a concentrate.
No one would they call them musuch.
Musuch, yeah. Come you taking me back. Musuch, yes. The one would you sue, and then you progressively dilute it by you increase the volume. So you've got probably 50 mils of it, and you can increase the volume to about 500 mils if you keep on adding more and more water. So I want people to think about that when you start during pregnancy, when the woman starts accumulating more fluid, the water part of the blood is called plasma. Okay. There's an expansion of that particular volume by as much as 30%. It can climb all the way to about 30% of what the normal volume is. And when this happens, the red cells, which are bathed in this liquid called plasma, then the concentration will drop.
Okay.
So that's one of the first mechanisms. So we'll call this a dilutional anemia. All right?
Okay.
Then the second thing is that during pregnancy, there's increased iron demand to support fetal growth. There's a new human growing. It needs nutrients. One of the important nutrients it needs is iron. So where is it going to get the iron from? It's going to take it from the mother. So the mother tends to develop, anemia.
Okay.
Because the child is drawing a lot of the dietary iron. So if the woman continue to eat the same way she was eating before she became pregnant, she's likely to become anemic.
Oh.
Yes, because your body will take what it needs for your normal function. Now they're two. So sometimes you hear them saying they are eating for two.
Yeah.
Well, it's very true. Because there's somebody growing who needs part of what you're taking.
Right.
So that also is the reason why it happens. Now, let's look at some of the factors that increases one's risk, or why does anemia happen a lot during pregnancy in our part of the world. The first thing is inadequate nutritional intake. Sadly, sometimes when we are in this part of the world, in Ghana, in Accra and all of that, you don't see Ghana properly. And this reality hit me when I had to work in the Asante Achim North and some other parts of the country. Things are very different. There's still a lot of the man gets the choices meat. The man gets served a certain way, and then the woman gets whatever is left over. Yes. Then the children will get, so the woman doesn't, eat very nutritious meals. It's still a very, very big problem that we have. So inadequate nutritional intake amongst women in the reproductive age group, it's a big reason why we see this. And part of the reason why the preconception care is very important. Because we need to see this, we need to correct this before the woman takes seed.
Okay.
Or the fetus starts growing. The second reason is the poor absorption of dietary iron. So the commonest anemia we see is what we call iron deficiency anemia. There are other nutritional anemias. You have the folate deficiency, folic acid, and then the B12 as well. These are all gotten from food sources, all right? Mm-hmm. And the absorption is also very important. It happens in certain parts of the intestine. And for example, for iron to be absorbed very well, you need vitamin C to go along with it. So tell you, for example, to eat an orange, for example, with a meal. But typically, how do we eat in our part of the world? You need 2-course meal, you need 3-course meal. One straight.
Team.
And then we are done. So oranges, for example, vitamin C is very, very, very important to aid in the absorption. So even if you are eating well and you have absorption problems, you may not get the required iron that you need. Again, some people may have some underlying medical conditions that prevent them from utilizing the iron that they have. So, for example, individuals with chronic kidney disease and some other conditions. Again, closely spaced pregnancies. So when we talk about family planning, that's part of the whole, point, to make sure that after that 9 months, when that baby was growing and taken from the mother, that mother needs time to recuperate, to get everything back that has been taken away. And therefore, closely spaced pregnancies are some of the reasons why anemia happens. Again, if you carry what we call multiple gestations, multiple pregnancies, so you've got twins, you've got triplets, you've got quintuplets, then, of course, based on the earlier explanations, we can understand why you will be drained from them. Okay. Then there's also that vomiting in pregnancy. Kwame, you know about that. Yeah. That's morning sickness. Yeah. Some can be very, very terrible. We call it emesis gravidarum or hyperemesis. You're vomiting so much they can't keep anything down. It's not a question of they not having access to good nutrition, but they just can't keep anything down. So these are some of the reasons why.
Okay. Well, if you're listening and you have any questions, please share with us on WhatsApp 055-1111-997, or you can call us on 0302-216-541. That's 0302-216-541. Okay, so how dangerous is anemia in pregnancy? I mean, is it that dangerous?
Kwame, it is very dangerous. It is a danger to the mother, and it also poses great threats to the survival of the fetus. So let's look at the mother for one moment. There is an increased risk of death from the pregnancy because of anemia. If a woman hits labor anemic, there's an increased likelihood that they will develop something we call postpartum hemorrhage, bleeding after birth. So mortality rates are higher in women who are anemic compared to women who are not. They also have an increased susceptibility to infections. Iron is very, very important for the overall function of the immune system, all right? And therefore, if your iron stores are depleted, you tend to get infections easily. And that is not something that you want during the pregnancy. There's also the increased risk of preterm labor. So you know about the 37 completed weeks where we'll say term, and then the 40 weeks, which is a date that most of the time we'll give you. We don't want the baby to come before that. And that is what we mean by preterm, if you are having a baby before the 37 weeks. There are also cardiac issues, fatigue and tiredness, all right? And then also, as I mentioned, risk of infections. So these are some of the things, or the things that can happen to the mother.
Okay.
Now, when it comes to the fetal complications or risks to the fetus, there's something we call intrauterine growth retardation. Oh, Kwame, we all expect the fetus to keep growing. So at every antenatal visit, you go and lie on the couch, or the woman lies on the couch, and then we'll bring out our tape. Yeah, but we're trying to estimate the growth of the baby in there. And if the woman has anemia, then most likely this baby will not grow as expected. And that is what we mean by intrauterine growth restriction. Another thing is the risk of preterm birth, and this whole issue about what do you call that, incubators and neonatal intensive care units. Quite in this country, I think Joy FM some time ago did something about the Confanoche mother and baby unit. Yeah. Even the whole Confanoche, look at the challenges that they had. So when you come to neonatal intensive care unit, I'm sorry, it's one of the areas where we're not doing well in this country. So we don't even want to have preterm births for these newborns to need those facilities, because then they are, that period is fraught with a lot of challenges. There is also increased perinatal mortality. A lot of newborns die in the first 28 days who are born to mothers who are anemia. Of course, if the mother doesn't have, the neonate also likely would not have enough. And then, Kwame, most importantly, there are long-term cognitive development problems. Iron is needed for brain development. It is absolutely crucial. Oh, the child is not doing well in school. Poor cognitive development, most likely iron deficiency when your mother was carrying you. So these are long-term complications. So the child surviving that period, not dying, we don't know that the human capital needs of the country is such that our children we need to have children who have the best chance to learn coding, robotics, NSMQ, and all of those things. But if you are deficient in iron in utero, it's going to follow up with you throughout life. So these are some of the dangers with iron deficiency.
You've revealed a lot that probably a lot of people didn't think about. But this is very important. It's a very important conversation. The question now is, what do we do? And people who are looking to conceive.
Right. So again, the first step would be preconception care.
Right.
Just because you have the desire to have a baby this year or next year, come see us. Go and see your midwife. Go and see a doctor, and say, "Doctor, today I'm not here because I have headache or abdominal pain. I'm here because I've got desires, I've got fertility, wishes." And then let's start from there. What would the doctor do? We'll run some tests. And these tests are very, very simple. A full blood count. That's always the first step. All right? Then from there, if your HB is below 11, or in this case, you're not pregnant, so below 12, then we'd say anemia. If you're pregnant, early pregnancy, and it's below 11, then we'd say anemia. And then we would look into the causes of anemia. If we're suspecting iron deficiency anemia, your doctor will request some more investigations. And all these investigations are not sophisticated investigations. They can easily be done. I mean, things like a stool examination, looking for things like worm infestation, they can easily be done. All right? Yeah. Probably we'll take an ultrasound scan. We can easily do a kidney function test, which is most of the time a blood test, to get a better understanding of why you have anemia. Right. So that's the universal screening for anemia, which is typically done for every patient who attends the antenatal clinic. So Ghana, we've got a very, very wonderful antenatal program, and we would encourage all women, the first time you know you're pregnant, report at the antenatal clinic. And we've got a wonderful ANC clinic going on, at Medica. So join. Number 2, we need to provide comprehensive nutritional education. Okay. All right. Yes, that thing is not true. We should stop that. You've got to eat. You've got to be deliberate about what you are eating. Vitamin B12, for example. I mean, the sources are there. Folic acid, the sources are there. So you need nutritional counseling. So again, the approach is multidisciplinary. So if you come, Sandra Teta is there. She's our dietitian. Wonderful woman. She'll take you through all of these things. The midwives would also give you some basic nutritional education. And if you look at Ghana's antenatal booklet, it's wonderful. It's got all these things as images. My mother teaches P1, lower primary teacher. So, picture reading. She says that picture reading is the best. So our antenatal book has a lot of these pictures in there. Okay. And then we will tailor the interventions based on the etiological factors. All right, so if you are iron deficient, then we'll give you iron. If you are folate deficient, we'll give you folate. If it's because you are vomiting so much, we'll deal with the vomiting so that you can eat. All right, so the solutions are all around us, but you need to take the steps and come in for us to do the evaluation.
Well, this is good. If you have questions, you can WhatsApp us on 055-1111-997. Got this one here. Is it true ILO eating affects blood during pregnancy?
Yes, so ILO is clay. The time they call it was Chile.
Okay, yeah.
Or something as well. Yeah. So it's pica, something we call pica. Pica is when you have an appetite for non-food items. Typically happens during pregnancy. So Chile, ILO, or ice cubes, and things like that. And then there's this desire for it. 2 things. It's dirt. It's clay. So sometimes it may have worm infestation, hookworms, the eggs, and all of that, because it's in the soil. All right. So eating that, you may introduce that in there. And hookworm infestation is one of the commonest reasons why people develop iron deficiency anemia. All right. Okay. So the pregnancy itself leads you to eating things that are not nutritionally healthy because it has nothing in there. Maybe it gives you some minerals.
It doesn't have anything in there.
No, I mean, it will give you some minerals, calcium and things like that. But in terms of iron, folic acid, protein, it has nothing. It's clay. All right? So you're not eating enough. Then secondly, you may be introducing hookworm and all of that into your system, and that can give you anemia. So, yes, the desire comes up during pregnancy. We call it a picker habit.
Okay. Yeah. Well, this is good information. Ladies, well, there you go. Gentlemen, now as well. I'm sure the people out there who will probably want to reach out to you and get some consultation. How do they do that?
Right. So for those who want to reach out, you can come by. It's number 10 Kincho Street. That is our East Legon Hills branch near Ashalibotwe School Junction. You can also come to Mampong on the N4 highway. But you can reach us on 0501 477 340. 0501 477 340. If you want to send us a WhatsApp, it's the same number, 0501 477-340. Kwame, we've got a vibrant antenatal clinic and run by both midwives and then also by the doctors and then the specialist obstetrician gynecologists. And so for there are 3 tiers. And I'm sure there are members of the team who can answer all questions and take care of you during the this pregnancy period. We should stop anemia in pregnancy. It's not really a big deal, but unfortunately it is.
We're grateful for the education, and I'm sure folks will reach out so that we can actually get it sorted. Thank you, Dr. Osafo. It was great having you here.
My pleasure.
And we'll do it again next week.
Sure.
Thank you. Dr. Yaw Osafo is the CEO of Medicas Hospital in East Legon Hills and Mampong Equiapim.